Hello, everyone. Welcome to this channel. And in this video, I would like to talk to you regarding OET subtest reading. I have this question that you can see on the screen, and I asked about it different people, and some of them answered me correctly, and some of them answered it incorrectly. So in this video, I would like to discuss it a little bit with you. The approach we should have for like such questions, and what strategy should be used. So sometimes people make this mistake that when they read the question, then they go to the options, and then they kind of mix up the options with the text, because you don't need to read the options after you read the question. What you need to do is read the question first, understand the question well, then go straight to the text, to this small paragraph that you see down below the options, and find answer to this question by yourself in the text. And once you do that, then you can come back to the options and match your answer with these options, and you know which option matches with your answer that you have found by yourself, then you can choose accordingly. Let's discuss about it and follow the strategy that I talked about. So, okay, the question says, the guidelines establish that. Now, the question is very simple, straightforward, no difficult words in it. And what we need to do is, now we understood the question, that the question is asking what is discussed in the text, right? What does this text suggest? These are actually guidelines about something that we don't know yet about. Once we read it, then we will know about it, okay? So we understood the question. Now let's find answer to this question in the text. Now we need to read these guidelines and understand them. Okay, so look at the text. It says, the first time any procedure is performed on a patient, the student should be adequately and appropriately supervised. Now it is very simple, very straightforward, no difficult words in it. Everything is very clear. Okay. The next says, what constitutes adequate and appropriate supervision depends on the level of risk of the procedure. Okay, what type of supervision is needed? It depends on how risky the procedure is. For example, then they have given examples. Phlebotomy or IV placement could be supervised by an intern or a nurse. They have then mentioned two procedures, phlebotomy or IV placement, as examples, and then they said that who can supervise a student for these procedures? An intern can do that, as well as a nurse can do that. Okay. Now, but whenever you see the word but or whatever or however, such linkers are very important. You should know that an important informations are coming, so you should be very careful. Okay. But central line or arterial line placement should be supervised by a fellow or a highly experienced resident. Now, it is very important. They have given examples that phlebotomy or IV placement can be supervised by an intern or a nurse, which are simple procedures, right? Then they have given two more examples. Central line or arterial placement should be supervised by a fellow or a highly experienced resident. It means these two procedures cannot be supervised by an intern or a nurse. For such procedures, a fellow or a highly experienced resident is required. In all cases, the supervisor should have a level of expertise with the procedure that allows him or her to perform it comfortably and independently. Like whoever supervises a person, he himself should have, or she should have, enough knowledge or expertise to perform that procedure independently and comfortably. Okay. Now, we understood the text, that if a student is doing something for the first time, he or she should be supervised. Then It also says that what is an adequate supervision, it depends on how risky the procedure is. And then they have given examples like phlebotomy or IV placement, which can be supervised by an intern or a nurse, which are simple procedures. But then they have also given examples of complex procedures. For example, central line or arterial line, which are complex. So for these procedures, a fellow or experienced resident is required. So we have different procedures and different supervision is required for them. Then it says that if a person is supervising any other person, he himself or she should be able to perform that procedure as well comfortably and independently. Now let's match the text with our options. What does the first option say? The student should always be under supervision when performing a procedure. Does it match with the text? It does match a little bit, but not exactly. And at one point, it contradicts the text. Look at it. It says the student should always be under supervision. Very important. Look at the word always. But the text says the first time any procedure is performed on a patient, the student should be adequately and appropriately supervised. The text says the first time, but the options say always. So it does not match. So we can exclude it. Now let's look at the next one. How dangerous the procedure is? Option B. How dangerous the procedure is determines the appropriate supervision that is required. Yes, it does talk about it. It says what constitutes adequate and appropriate supervision depends on the level of risk of the procedure. Synonym, they have used synonym here. Look at level of risk, and option says how dangerous. So these are synonyms and they match with each other. And then they have also given examples about complex and simple procedures and supervision for them, what type of supervision is required for them as well. So we can stay on this, but let's look at C as well. A student should be under supervision by a fellow when performing a phlebotomy for the first time. It does talk about phlebotomy, it does talk about fellow, it does talk about student, but it does not talk about the whole of this option. You see, it does not say that students should be supervised by a fellow if he or she performs phlebotomy. No, they have given phlebotomy as a simple procedure, and fellow or a highly experienced resident is required for complex procedures. Those are central line or arterial line. For phlebotomy, an intern or a nurse is enough. But it says a student should be under supervision by a fellow when performing a phlebotomy for the first time. So we can exclude A and C, and we can comfortably say that B option is the correct option here. So if you have chosen B, well then, if you did not choose B or chose any other option, then it's okay. You just need to have a proper guidance for it and proper strategy for it. So I hope this video was helpful for you. If you are not subscribed to our channel, please subscribe, and we will update you on daily basis, and we will try our best to upload a video every day. And thank you so much for watching it. We will appreciate your support. Please subscribe to our channel. Thank you so much.